What subtle cell changes does a pap smear find? Imagine a tiny detective working inside your body, looking for clues that could signal trouble before it becomes serious. That's exactly what a pap smear does. It examines cells taken from your cervix under a microscope to find very subtle changes that might be early signs of health issues. These changes are often so small that they are invisible to the naked eye, but can tell us a lot about what's happening inside your cervix. One of the main things a pap smear looks for is atypical squamous cells. These are the flat, thin cells that cover the surface of the cervix. Sometimes, these cells look different from normal cells but don't necessarily mean you have cancer. For example, if the report says atypical squamous cells of undetermined significance, it means the cells aren't normal, but it's unclear whether the cause is an infection, irritation, or a human papillomavirus infection. The test also detects low-grade squamous intraepithelial lesions, or LSIL. These are mild abnormalities often caused by human papillomavirus, which is a common virus linked to cervical changes. Usually, these changes resolve on their own without treatment, but they are important because they can sometimes develop into more serious issues if left unchecked. More concerning are high-grade squamous intraepithelial lesions, or HSIL. These are more severe abnormalities that have a higher chance of progressing to cervical cancer if they are not treated. Detecting HSIL early allows healthcare providers to intervene before the condition becomes invasive. The pap smear can also identify atypical glandular cells. These cells line the cervical canal and the inside of the uterus and produce mucus. Changes in these cells are harder to interpret but can sometimes indicate more serious problems, including precancerous or cancerous conditions. Because glandular cells are less common in pap tests, their abnormalities often requiring additional testing for clarification. In addition to abnormal cells, the test may reveal signs of infection or inflammation. These findings are usually caused by infections like yeast or bacteria and are not precancerous. Still, they may need treatment to clear up the infection and prevent further issues. Finally, the pap smear can detect cells that have undergone significant changes in their nuclei, such as enlargement, irregular shape, or increased nuclear size. These features suggest that the cells might be precancerous or even cancerous. The presence of coarse chromatin or irregular nuclear borders can be clues that abnormal growth is happening, prompting further diagnostic steps like colposcopy or biopsy. All these subtle cellular clues help doctors catch problems early, often before symptoms appear. The goal is to identify and treat precancerous changes or infections early, reducing the risk of developing invasive cervical cancer. Remember, a pap smear is a vital screening tool, but it's just one part of a comprehensive approach to cervical health. If your results show any abnormalities, your healthcare provider will guide you through the next steps, which may include additional testing or treatment. Always consult with a medical professional for personalized advice and care.